Hello, this is a video to help dentists and their teams learn new ways to calm your anxious dental patients so you can build better rapport, give your patients a better experience and promote your services in the process. I'm Andrew Kane. I'm a hypnotherapist, coach and trainer, and since 2003 I've trained thousands of dentists and teams in techniques from the world of hypnosis and therapy that you can use in your dental practice. In this video I want to show you a simple, powerful way you can start orienting your anxious patients away from being dependent on you doing something to help them and towards becoming better able to do those things for themselves. If a friend told you he or she was upset or angry or scared, what would you ask? You'd probably ask questions to find out more about it, right? Like why, what's happened, how did that come about, and so on. When there's a problem, our brains naturally home in on it to try and understand. And that's pretty useful up to a point. It expresses our empathy and allows you to work out how you might help. These kinds of questions, we call them problem-focused questions, are great. There's nothing wrong with them. But I'd like to show you and help you notice two things about how these problem-focused questions relate to an anxious patient and how you might change that. First is that the patient is probably already overwhelmingly focusing on the problem to begin with. So the questions are reinforcing what's already happening. They're not changing the patient's perspective. If anything, they're entrenching it even further. And second, the questions are ignoring all the same things that the patient themselves is ignoring, the resources, skills and experience that they can bring to bear to feel calmer and more in control. Inadvertently, only asking problem-focused questions can keep a patient stuck in the same powerless orientation that they came in with. And despite your best intentions, when you take too much responsibility and try too hard to try to calm down an anxious patient, trying to fix their anxiety in the same way you'd fix a clinical problem, without meaning to, you can end up keeping them feeling dependent and helpless, like they're the one with the problem and you're the one fixing it. That feeling of powerlessness is a big trigger for anxiety. So to help long term, you want to encourage your patients to identify what they can do to help themselves so they can start experiencing more autonomy and control in the situation. So the next time you're working with an anxious patient, carry on asking them about their anxiety, any triggers you might be able to avoid and so on, so you understand what's going on and you can communicate that you care. But once you've opened up communication, also ask questions about solutions, the resources, skills and experience your patient has that might help them. Be curious to find out about what they are and how your patient can use them. So some examples might be, what do you do that helps you feel calmer? When have you felt more relaxed during dental work? What do you do to manage your nerves in other situations that you find difficult? I wonder if you can tell me about a different situation when you were anxious but which you managed to handle successfully and what you did then that helped. Then shut up. You're asking the patient to think in a different way to how they do normally. So it might take them a few seconds to work it out, but that's the help that's happening there. You're not fixing this, remember. You're helping them to start fixing themselves. You're pointing them towards their own resources so they can begin to feel more confident and learn how to do that. It's easier for you and it can be genuine progress for them. If they're too anxious to think about anything there and then give it to them as homework to think about before their next visit. You might include these kinds of, as they're called, solution-focused questions on your new patient form. or on a separate calmer experience form for your anxious patients. So they've started thinking this way before they arrive, and you've already got some ideas right there that you can use right off the bat. If you're thinking, oh, I know patient X and I don't think this would work for them, then that's okay. No one standard approach is going to help everyone universally. But as you learn more techniques through the e-course and through these videos, you'll have a greater range of options. And the more options you have, the less you'll get stuck, because you'll be able to more and more fluidly switch to whatever would help most in any particular moment. So the next time you're talking with an anxious patient, take an interest in their anxiety and what you can do, but also take an interest in when they feel better and what they can do to help themselves. It's easier for you and it's better for them. I'll send you another tip soon. And if you'd like more of this kind of thing for yourself or your team, you can do that in my short CPD e-course on hypnosis and relaxation techniques to calm anxious patients, which you can find at calmerpatients.co.uk. Thanks for watching. I'll see you soon.